Hey everyone, Tom Swales here, Advanced Movement Therapist. Today is video 4 of the GS low back pain series. So if you have not seen video 1, 2, and 3, go back and do those first because those teach us how to feel the proper core muscles, how to localize, isolate them, and then today we're going to stack that spine. We're going to get some rotation control. Is we're going to just get a band, and if you have a ball, a foam roller, something to squeeze between our legs, we're just going to utilize the groin muscles, the adductors here, to better get engagement of the lower abdominals, but also take away some of the tension that a lot of us will carry in the outer hips. A lot of you may be familiar with this. It's going to be some Pallof pressing. Okay, so but before we set this up, we're going to set the inner core with a breath. We're going to posterior pelvic tilt by locking those glutes. We're going to squeeze that ball. So we're just going to fine tune this a bit. So we're going to go in the tall kneeling position, and I'm just going to press this out, okay? We're going to stay here for a breath, fully in, and then come back, okay? So a lot of the muscles, the anti-rotators in the trunk, we want to control the amount of rotation that comes through the spine, okay? Because rotation should be coming from the hips and the thoracic spine. So we want to have the system feel how that's supposed to lock in. Once we have a feeling with this, then we can start adding in some control and some rotation back into it through some certain ranges. So as I press away, I really feel my right glute kicking in, but I still have to keep that squeeze on the ball so I don't fall into this anterior pelvic tilt or this extension that a lot of us can get caught into. So we're going to stay out here in those inner ranges and then come back. So we're going to move slowly, and then as you get more comfortable, you can add a little bit more speed. Moving into the half kneeling, if there's more of an asymmetry going on, and I like doing the half kneeling position because it just challenges the system a little bit more. We're going to come up. So I got this back leg in, posterior pelvic tilt, glutes locked on, ribs are down with the breath, and I can press and I can rotate in this position here. So I can really feel my right glute on fire right now, but it's connecting with the oblique system so that when I'm pushing and I'm moving in this frontal plane and transverse plane, I'm using those muscles more down here and not in my lower back. Moving more into anti-extension to really get those abdominal muscles to pull down, to pull us through, to help give those low back muscles a break. We're just going to anchor the band overhead. We're still going to use our ball or a block to squeeze. And I'm going to grab onto my band like this. So you can see as I stay relaxed, I get caught in this anterior pelvic tilt. That's a lot of compression in my low back there. So when I set this up, I'm going to set the breath. I'm going to squeeze the glutes. I'm really pulling those ribs down, so I'm keeping those anchored. And I'm just going to pull straight over. Okay, so this is an anti-extension exercise. We're not really encouraging flexion at this point for this exercise. We want to maintain a nice tall posture as we feel those anterior abdominals, those anterior core muscles keep engaged. So as I go up, I might hit some tension on my lats. My system's going to want to let that go. Really resist what is happening through here. So if we do have some tight lats, it may be a little bit of weakness in this range, but the control is going to come from the trunk here. So we can stay here, hold, feel those muscles, crush that ball to really get the brain to find those muscles to help support the low back. We're going to work on some diagonal movements, okay? So taking that half kneel position, the close leg to the band is on the knee. That's your support leg. I'm going to grab the band with a double overhand position, keep that posterior pelvic tilt, and I'm going to lift and drop down. So as I lift, I lock, inhale, come back down. So the goal is to control diagonal rotation and side bend, so this three-dimensional movement that's happening. So the band's trying to collapse me down into flexion, but I have to use some of the rotators and extenders on both sides to help create this diagonal movement. So this diagonal lift is working on an extension pattern, but we have to try and resist that. We're going to keep the glutes on so we're not extending and rotating into the lower back. And then lastly, we're going into our diagonal chop pattern. So we're maintaining that nice, stable locked pelvis, tall spine, and we're just creating rotation, direct or diagonal rotation forces around the trunk and the pelvis that we're trying to control. So we're gonna bias more flexion here as we open up that low back. We can hold it till we feel it, and then we slowly come back into start position. I hope you found this video series helpful. I use these exercises with my alpine skiers, and they get a lot of relief and they get a lot of benefit from doing these exercises. If you're an athlete, head over to my YouTube channel and you can find lots of ways to self-assess and correct some of the pain or issues you may be having. If you're a coach or if you're a medical professional who's looking to add more precision to their practice with a systematic and more organized framework to get to the root cause and get your athletes performing better, head over to amtcertified.com and get certified today.